what are some of the most damaging things that people are doing in their life that is hurting their vascular health and making more likely for them to have erectile dysfunction?
Diet is a huge one, and we haven't talked a lot about it, primarily because there's not a ton of data on specific diets, right? The best data we have is on the Mediterranean diet. So that was well studied in many studies, and that's basically a diet that's high in vegetables, high in healthy fats, a little bit of meat, a little bit of fish, but really and nuts and seeds. So trying to get, and no processed foods, trying to limit any, nothing processed, all natural foods. And so those diets have been shown to be beneficial in terms of vascular health and sexual function. But I would say generally what I tell people, and I'm sure most of your audience already does this, but avoid processed foods, avoid a lot of simple sugars. So anything that's white, right? No pasta, no carbs, not carbs, but no simple carbs.
Refined carbs.
Right. And so those are sort of, I think, the biggest implicators of issues in terms of sexual health. And that's like your whole life, right? That's something that you're doing all the time. And so over a lifetime, it's not always going to be perfect, but try to do the best you can, at least 80% of the time, to get good, healthy, nutritious food in your body, not junk food. And then in terms of helping with other things that you can do. So I think really excessive alcohol, while some people, usually, I guess. So alcohol, if you're to excess, will affect sexual function. Marijuana to excess will affect sexual function. So I think in general, when you're doing these other behaviors, just kind of taking a second to see how many drinks am I really drinking a week? How much am I really doing? And there's more and more data that alcohol is so damaging. Any alcohol is damaging for cancer risk, for a host, a variety of things. So really trying to limit your alcohol intake and marijuana. Again, there's not as much data, but we know that excess marijuana intake will affect fertility and can affect sexual function.
On the topic of erectile dysfunction, you can't talk about ED without talking about nitric oxide. And it obviously plays a role in men and women. So this could be a good opportunity to first talk about men. Talk to us about nitric oxide and the importance of nitric oxide.
Yeah, so nitric oxide is essentially the ignition for erection. So when you are aroused, your endothelial, your lining of your blood vessels will release nitric oxide. But you need stimulation for that to happen, right? So you need to be aroused, see something, hear something, see something that gets you aroused or that makes you think about sex in a positive way. And then your body will release nitric oxide. And then it sets off a cascade of factors that then causes blood flow to go to the penis, blood flow to stay in the penis, your smooth muscle relaxes, you get an erection, and then it stays there. And then as soon as those factors degrade, the smooth muscle contracts, blood flow leaves the penis, and then your erection goes away. So that's why it's sort of really important for that part and can help. Essentially, that's why a lot of things you'll see online are like boosting nitric oxide, because they may help boost your overall sexual function and endothelial health.
What are the things that damage our body's normal production of nitric oxide?
I mean, it's all the things we've already talked about, right? So if you have metabolic syndrome, you've got high blood pressure, you've got high cholesterol that's forming plaques in your blood vessels, you have diabetes that's affecting the structure of your blood vessels. If you are smoking, those things are just number one going to affect nitric oxide production. And so keeping it all goes back to cardiovascular health. Doing the things that are good for your heart are going to be good for your sexual function.
There's been a few dentists on this podcast that have come on and said that traditional mouthwash is something that damages our oral microbiome, and that those bacteria are key in the production of nitric oxide. Have you come across this? There
is, I don't have the numbers in front of me, but there are some people who notice their erections are not as strong when they use mouthwash. I think that's probably the reason why. But I would leave it to the dentist to discuss the value of mouthwash in your dental hygiene. But I think, yes, there are some people who do see that, and I've definitely come across it before.
What about this other one? This idea that a big part of nitric oxide production is nasal breathing. Have you heard about this?
I have not. I think there's a lot of benefits to nasal breathing and plentiful benefits. And so certainly it's not going to hurt you to nasal breathe. It may even make your face structure look a little better. So overall, I think it's a good idea to nasal breathe, at least at rest. And then as you know, in terms of when you're doing more exertional activities, do what your body needs.
Viagra, Cialis, these things play a part in helping with nitric oxide production?
So they don't make nitric oxide. The way they work is, so when you have an erection, nitric oxide creates a cascade of events. When you have nitric oxide, you basically convert certain enzymes in the cells, cGMP to CAMP. That keeps the erection alive. Phosphodiesterase 5 breaks down that substance, CAMP. And so that is what stops the erection. So these medications inhibit phosphodiesterase 5. So they allow you to maintain that erection for longer. That's how they work. And they do need stimulation for them to work. So you're not going to take it and get an erection. You need to have stimulation for them to work. They typically take about an hour before they're ready to work. And so generally we tell people take them an hour before wanting to have sex. You need stimulation for it to work. They do last in the body for some time. So if you take it a little before, like say you want to have sex after dinner, you could take it before dinner and then it'll still be there. Viagra lasts about 4 hours and Cialis lasts about 36 hours. So you could actually take it and then have a whole weekend if it's working well for you. With Viagra, the one thing people often forget is you need to take it on an empty stomach or a light meal. It doesn't work as well. You'll just get the side effects without the effect with Viagra, whereas Cialis you can take with food.
Are you familiar at all with, I feel like in the last few years, there's been different sort of modalities that are practicing some version of shockwave therapy. Mm-hmm. So can you explain to our audience what that is and then your opinion on it?
Yeah. So shockwave therapy is essentially we've used shockwaves for a lot of things. So in urology, we use it for kidney stones, and they help break up kidney stones. They've used it in cardiology for different arrhythmia type things, but now they've done studies on it for erectile dysfunction. And when you have the right type of shockwave, meaning it has the right depth of penetration, so it's a deep shockwave, it will create over time changes in the structure or the blood vessels in that area. So it creates angiogenesis. So it creates new blood vessels in the erectile tissue. And that's how it works. We're actually improving arterial flow because we're creating new blood vessels. Now, the data is reasonably, there's a lot of data now. And what we've seen is that it does work pretty well in the short term. So we're seeing good results in the short term, but after about a year, 50% of people are seeing improvement. And it really works for people who have mild to moderate erectile dysfunction, not for people who've got really severe erectile dysfunction, not for people who've had prostate surgery. At least that's not what the data shows yet. Not for people who have other causes like neurogenic causes of erectile dysfunction. But what we're now seeing is that it does work pretty well. It is the only regenerative therapy that has the most robust data. Now, there are other regenerative therapies like PRP injections, there's stem cell therapy that's sort of still investigational, and shockwave is still considered investigational, but it has the most data. And it's really low risk. It doesn't create any long-term, there's no side effects. There might be a little bit of soreness, but overall there's no long-term side effects. You're not going to injure yourself. And so for that reasons, it's nice, but we still don't know the optimal protocol because how often should you be getting it? Usually you'll do like one session a week for 6 weeks. And then after that, it's up to the practitioner to decide how often you're going to get it or how often you need it. Should you get it every 6 months, every year, every 2 years? We don't really know yet. And so it's still considered investigational. But the issue is that a lot of people are offering it and they're offering radial shockwave. And radial shockwave is not deep enough to actually penetrate the tissue. So you're just getting a massage, basically. You're not like getting the actual shockwaves. And they're charging a lot of money. And so as a urologist, I've started to feel like obligated to at least offer it, because if people are going to pay for it and it's not covered by insurance, that you should get it from someone who's giving you the right thing, up to date on the literature, who's following the data, and so that you're at least getting the right thing and the safe thing and not getting just taken advantage of. And so I think it's important to really investigate if you have the expendable income and you want to try it, there's no harm in it, right? It may help you and it may save you from taking a medication, or it may make the medication more effective. But it's not something that we have a home run for, and it's quite expensive right now.
Anything else on the topic for men and erectile dysfunction that you feel significantly moves the needle forward?
I think that I think really the important thing to take home is that if you're struggling with erectile dysfunction, like it is a very difficult topic. It is very easy to go in the gas station and buy something, or look for sources that are easily obtainable. But realizing that like this is something that you can absolutely talk to your doctor about. We're here for you. We want to help you, and we want to make you better. And I wish that we had more regenerative treatments. All the treatments we have are they're just treating the issue, right? They're just giving the ability to get an erection at that moment, but they're not reversing the problem. Reversing the problem, hopefully Shockwave will be something that does that, but also exercise, like we've talked about so much, and getting a good diet. We've seen data that exercise actually can reverse erectile dysfunction. And so really starting to do that, you will see better erections. In fact, it may actually make your penis look longer because you're losing weight and it appears longer to you. So there's lots of benefits to exercise. But overall, I think just realizing that we want to help you and we're here for you.
Well, I'm giggling a little bit because you said, make your penis look longer. One of your top videos on YouTube, when you organize by popularity, is titled, "Can you increase penis length?"
Yeah.
Can you?
So, there's a lot of things that have been tried. There's surgical, non-surgical options. And when reviewing them all, traction therapy has shown in some studies, so traction therapy is essentially a device you put on the penis and it stretches the penis. And the studies that were done were like 6 hours of traction therapy a day can increase penile length by about 2 centimeters. Now, there's additional studies that are being done with other devices for post-prostatectomy patients and for people who have Peyronie's disease that are showing similar results with shorter duration of use. So using it like 30 minutes twice a day. But ultimately, those things can work and they're generally safe. But you do have to be committed to doing it and continuing it.
We're going to come back to some of your top content, your greatest hits that are out there based on virality, at least.
Sure.
You didn't decide to make them top hits. And we want to go back to anatomy. I think there's some very basic aspects of the biological male anatomy, the biological female anatomy in particular, that we just don't really fully understand or don't get taught. And we were chit-chatting a little bit before we started recording, and we were talking about the very challenging sort of state of sexual health, reproductive health, education here, especially in America, and I'm sure around the rest of the world. So I'd love to start off this with, let's think about female anatomy. What are still some of the top myths that you see floating around there that could be a great place to start the conversation? YouTube, if you enjoyed what you just saw, keep watching for more great content on how to improve your brain and your life.
So very often when men develop sexual dysfunction or erectile dysfunction, it's because they're having vascular dysfunction and they have not yet developed problems that are dramatic enough to affect their heart.